Hi guys, here's your How to Survive for Camera Thompson part 3. That's right, she's back again. So you can find out what's going on with her by reading the case posted to Entrada. Once again, there's no new video for this, but you can get a little bit of a feel for what's going on with her. We have 3 disciplines: pathophysiology, microbiology, and immunology. Now I want to point something out. Some people have asked occasionally for full-length lectures instead of videos. I've gone back and forth on that because it's kind of counterintuitive to what we're doing. But if there was ever an organism where I was willing to give you the full-length lecture, it's the Mycobacterium. This includes Mycobacterium tuberculosis, Mycobacterium leprae, and then a whole bunch of other organisms that we won't really focus on, but one more that I do want you to know: Mycobacterium avium complex. So I'm trying it out. I went back and I listened to my Mycobacterium lectures for the last 2 years. I chose the one that I felt was better. It is an hour long. I talk kind of at the speed of a chipmunk because it's kind of a beast of a lecture. The course notes follow along with it pretty well, but just in case, I have also provided a link to the PowerPoint slides so you can take notes on the slides. If you are not the type that likes a lecture and you don't want to do it that way, I would suggest you take it organism by organism. The Mycobacterium is probably going to run you about 35 minutes of that lecture, and then leprae would be another 10, and then the remaining one would be another 5 to 10. So you could break it up that way and then just kind of find yourself throughout. If you find that that is too difficult, or you're like, I really can't sit through this hour lecture, let me know and I'll go ahead and make some videos. But I thought I'd try it out and see what you guys think of it, okay? All right, so then we do Bordetella pertussis and Haemophilus influenza. All right, so there's also some immunology. I'm going to lay the groundwork, the foundational material for vaccines, and then you have your study questions. So let's go piece by piece. Once again, check out the paper case. It's on Entrada. Then Pathophysiology, written by Dr. Hartley. So she goes through kind of the impact of pneumonia and the different definitions. So you have just pneumonia, you have community-acquired pneumonia, and hospital-acquired versus nosocomial pneumonia. So make sure you can tell the difference there. And then the symptoms associated with it. There are various complications that are associated that she goes through here, and then she goes through types of community-acquired pneumonia. It's important that you be able to differentiate between typical and atypical. And then we see different organisms causing pneumonia in different populations of patients. So neonates, children, young adults, elderly, aspirative pneumonia, HIV infection, alcoholism. Some of these you're familiar with, like we've already talked about Klebsiella pneumoniae, but you're occasionally going to come across something we haven't covered yet, like Pneumocystis jirovecii. This is technically a parasite these days, actually, yeah. And so we will cover this later, though. We're not covering it yet. Same with these, Cryptococcus, Histoplasma. We haven't covered these yet. Histoplasma is a fungal infection, so we'll cover these at a later date, so don't worry too much about them. Just start to recognize the names. But many of these you should actually be familiar with, which one of the things I really liked looking at this table was that it shows how far you've come, that here are all the things that cause pneumonia, and many of them you're familiar with, and you can probably draw out how they would happen. So that's really exciting to me as your teacher. Okay, then micro. We move on to add another streptococcus to your wide array of streptococcal knowledge. And now we're going to talk about Streptococcus pneumoniae. This is an important bug. Like all the other streptococci, you got to know it. So we added another line to the table here. This is not able to be grouped by the Lancefield groups. It has an alpha hemolytic growth pattern, and here are 2 tests that you can use to distinguish it from a different group of streptococci that we'll learn about next block, known as the viridans, which are also not groupable and have alpha hemolytic presence on blood plate agar, but they have different differentiating tests. Here are your main characteristics: structure, pathogenesis. It has a special virulence factor here, this IgA protease, that is only shared by a couple of other organisms, and it's worthwhile knowing those names. And then one of the things with strep pneumo is that you really need to have a predisposing condition in order to get pneumonia from strep pneumo. So make sure you're familiar with those. It's the number one cause or most important cause of a couple illnesses, pneumonia being one, meningitis in adults over the age of 40, certainly that as well, and otitis media and sinusitis. So this is a big organism. You really need to know it. And then we go into treatment. The treatment here is a little bit difficult. We're going to talk about the treatment of pneumonia during your case session. And I actually spoke with Dr. Williams a good bit about this before putting this into your self-study. So I'd be aware of that. This is one of those empiric treatments that I said you absolutely have to know. So I want to be able to walk into your room on Thursday and go, what is the empiric treatment for bacterial meningitis? And have the whole room shout out ceftriaxone and vancomycin, as long as L-monocytogenes isn't suspected. Hey, do you know how to treat L-monocytogenes? Just a question. All right, nocardia. This is a filamentous gram-positive organism. Coxiella burnetii. So you've already had the video that contains Coxiella burnetii before. The last 3 minutes cover Coxiella burnetii. This isn't a major disease, so you can see there's just a paragraph. M. pneumo. This is a major cause of atypical pneumonia. So make sure you know this one, know the buzzwords, know how you can recognize it, the clinical disease associated with it, and how that influences treatment choice. And if you're looking here, levofloxacin is listed here, and you're right, it was listed above too. So that's probably a good drug to keep in mind. And I give you kind of a little cheat sheet of some things I like to keep in mind about M. pneumo. Okay, we start talking about chlamydia here, but we're not finished with it here. We're actually going to cover more of it in your sexuality and reproduction block because, well, chlamydia. But chlamydia actually also has some complications for pneumonia as well, especially in neonates. So pay attention to that just as a method, and Dr. Hartley mentions it in her self-study as well. So just so we're all on the same message. But there are two members of this family that do just naturally cause pneumonia, and that's Chlamydophila pneumonia and Chlamydia or Chlamydophila psittaci. Okay, so be aware of these organisms and how they work as well. All right, here is that Mycobacterium lecture. You can see I take you through the whole lecture in the course note. This is the link to the video. Yes, it's an hour long. And it will take you through the entirety of the course notes. Many of my slides are in here, but you also have access to my slides at the beginning of this packet in the table of contents. I give you various sites of infection where we might see TB outside of the lungs, even though the lungs are kind of our bigger concern. How we identify it, again, know those buzzwords, Lowenstein-Jensen, Middlebrook, those are important. But mainly we're going to diagnose it by PCR. Molecular testing is huge for diagnosing TB these days. But so is the tuberculin skin test, which many of you have had. This table is really important. This is how you begin to identify TB, and we're going to talk about it a lot in your class session. I don't go too far into treatment of Mycobacterium. This will be covered in much more detail actually at the very end of your preclinical curriculum. We're going to have a whole TB case where we'll go over this, so it's a way for us to reinforce it later. Then we go into Mycobacterium leprae. So this is literally leprosy, so you can go through that. And then there's all these other classifications for the non-tuberculosis Mycobacterium. Really, I don't need you to know all of these organisms, but I do need you to know MAC, Mycobacterium avium complex. Understand pretty much from here to here. If you know that, then you know enough of the MOTS. So for Mycobacterium, I want you to know the main characteristics. I want you to know tuberculosis. I want you to know leprae, and I want you to know MAC. Otherwise, the rest is window dressing. Bordetella pertussis, vaccine-eligible disease, but it is something that we do still occasionally see, especially in little babies, and it's got toxins, so you know I love toxins. Make sure you can recognize stages. So this one's got like a bonus round, toxins and stages. Oh my gosh, it's like Christmas to me. So I love both of these things. So make sure you know your stages, make sure you know your toxins. I do have a sound clip here of what whooping cough sounds like. It's pretty depressing, but check it out. And then we go into Haemophilus influenza. There is a sketchy video for Haemophilus influenza that's actually pretty good. They do make two little mistakes, which I mention in the Haemophilus video, and really it's just nomenclature. So it's not a big deal, but otherwise it's really complete. So it's worth checking out. So here is the main characteristics, and here is kind of the disease it causes, the clinical syndromes. Make sure you can recognize that. Again, I mentioned that there's one empirical treatment that you need to know, and then we talk about the vaccine. So while we're on the topic of vaccines, hey, let's do vaccines. So when we talk about vaccines, we talk about the difference between vaccinating and natural infection. Some of the videos in here are provided by me, and some of them are provided by Dr. Wong, who is a virologist who previously taught a lot in the immunology block. What we're talking about here are basically vaccination strategies. So how do we induce an immune response with vaccination? Antibodies are key. It's actually the goal of the majority of the immunizations we have. There's really only one vaccine that exists that's really going after T cells, and we don't even use it in America. So then we talk a little bit more about passive versus active immunity. You can go through that. You guys should all have a pretty good idea of what passive versus active immunity is by now. And we talk about where you might use those. Okay, so then we talk about the types of vaccines. There's two different types, live attenuated and then inactivated. Be able to differentiate between the types and the types of organisms that use both, because we'll apply that during the session. And then we talk about the types of immune responses. So do you have a peptide-based vaccine? Then you can engage T cells, which will lead to class switching and different types of antibodies. If you have a polysaccharide vaccine, well, remember, IgM secreting plasma cells or B cells that are stimulated without T cells don't make memory cells. So anytime you have a polysaccharide vaccine, you're not getting memory. So if you do a booster, you're just starting the whole process over again. And that's kind of what this paragraph down here says. And then we talk about the different mechanisms of vaccinating. So you can go through this. And then lastly, the part that I just want to go through a little bit is this methods to increase immunogenicity. So there's this concept of conjugation, where basically you link a polysaccharide to a peptide in order to increase the immunogenicity of the toxin. First off, it's not that the antigen is the same. It can't be the same because polysaccharides and proteins aren't the same. But remember, we talked about that cytokine microenvironment. So just by priming that T cell, you're going to create cytokines that can influence the B cell and potentially lead to class switching. And that can provide a stronger response and maybe even a memory response. Adjuvants are basically delivery systems that actually promote the delivery of the material in the vaccine that you're trying to get a response out of. And I've kind of summarized the main points of the vaccines here. So if you have questions on this, don't worry if you don't completely understand it. We'll have time to go over it more throughout your curriculum. Like I said, this is just foundational. All right, that's all for now. Good luck.